The role of genetics in boxer health. Boxers, with their strong and muscular bodies, are known for their agility and prowess in the boxing ring. However, behind their athletic appearance lies a breed that is prone to certain health issues. Many of these health problems can be attributed to genetics, making it crucial for boxer owners and breeders to understand the role of genetics in their health. One of the most common genetic health concerns in boxers is a condition called Boxer Cardiomyopathy. This condition affects the heart muscles, causing them to become weak and eventually leading to heart failure. Boxer cardiomyopathy is believed to have a strong genetic component, meaning it can be passed down through generations. This makes it imperative for breeders to carefully select mating pairs to minimize the risk of passing on this condition. Genetic testing can also be done to identify carriers of the gene, allowing breeders to make informed decisions when breeding boxers. Another genetic health issue that boxers are prone to is called degenerative myelopathy. This is a progressive disease that affects the spinal cord, leading to weakness and eventually paralysis of the hind limbs. Like boxer cardiomyopathy, degenerative myelopathy is believed to have a genetic basis. Research has shown that a specific gene mutation is more common in boxers affected by this condition. By conducting genetic tests, breeders can identify carriers of this mutation and avoid breeding them, reducing the risk of producing offspring with degenerative myelopathy. Hip dysplasia is yet another genetic health concern in boxers. This condition affects the hip joints, causing them to develop abnormally. As a result, boxers may experience pain, lameness, and difficulty in walking or running. While external factors like diet and exercise can contribute to the development of hip dysplasia, genetics also play a significant role. Boxers that have parents with hip dysplasia are more likely to develop the condition themselves. Breeders can minimize the risk of hip dysplasia by only breeding boxers with good hip scores and avoiding mating pairs that have a history of this condition. Epilepsy is a neurological disorder that boxers are genetically predisposed to. Dogs with epilepsy experience recurrent seizures, which can range from mild to severe. While the exact cause of epilepsy is still unknown, there is evidence to suggest that genetics influence its development. Studies have shown that certain genes may increase the risk of epilepsy in boxers. By identifying carriers of these genes through genetic testing, breeders can make informed decisions to reduce the incidence of epilepsy in their breeding programs. Apart from these specific health issues, boxers are also prone to certain genetic predispositions that may increase their susceptibility to various diseases. For example, their shortened snouts and flattened faces make them more prone to respiratory problems such as breathing difficulties and overheating. This is commonly known as brachycephalic syndrome and is a result of their anatomy rather than a specific genetic mutation. However, it is important for boxer owners and breeders to be aware of these predispositions and take appropriate measures to ensure their dog's well-being. In conclusion, genetics play a significant role in the health of boxers. Many of the health issues they face, including boxer cardiomyopathy, degenerative myelopathy, hip dysplasia, and epilepsy, have a genetic basis. It is crucial for boxer owners and breeders to understand the genetic factors involved and take necessary precautions to minimize the risk of passing on these health concerns. Genetic testing can be a valuable tool in identifying carriers of genetic mutations and making informed breeding decisions. By promoting responsible breeding practices, we can increase the overall health and well-being of this beloved breed.